5, 4, 3, 2. Hello and welcome again to another edition of Media Watch. I'm your co-host, Eric Tait. With me is...
I'm Bob Anthony. Good to see you, Eric.
Bob, here we go again. This is brought to you by EVT Educational Productions and the good graces of Manhattan Neighborhood Network. And we'll try to bring some perspective, slightly different than the usual, on some of the key stories going on locally, nationally, and internationally. So, what do you think, Bob? The ones that, of course, will be still high on the agenda come Monday when this airs is Ebola.
That seems to be all you hear when you tune in on the radio or on TV. We're being inundated but not educated.
I like that phrase. Inundation, not education. More heat, not very much light.
Right.
So let's try to recap a little bit. The biggest scare now, of course, is the fact that Ebola is in the United States of America.
Right.
And that's what's caused the, rush to panic or almost panic.
Right.
That's
the stress level went from 0 to 60 in no time.
Little or nothing, right. And primarily because once this particular patient, Mr. Duncan,
Eric Duncan, correct.
Yes,
the
Mr.
patient
Duncan from Dallas, right. He came from Liberia, ended up in Dallas. And of course, once he ended up there, we had lots of briefings from the CDC.
Right.
And this is where we want to step back and make an assessment, because Thomas Frieden, Dr. Thomas Frieden, that's the head of the CDC, Center for Disease Control
In Atlanta,
was a very reassuring individual when he talked to the country about how prepared the nation was, all the steps that had been taken, the fact that we have the world's greatest healthcare facilities in this country. And lo and behold, once that patient hit, they jumped out there with a lot of media briefings saying everything was under control. Bob?
And that's what I remember. We were given sort of the not a sugary statement, but a simple calming message that there's no real problem here. Yes, we know what he has. Yes, we're ready to take care of it. Yes, we know what the disease is, but we're set. We got this, was the message that I was getting in the beginning.
And that's the phrase. Not to worry, folks, we've got this. And our people are quite prepared. And it turns out that that particular Texas Presbyterian hospital in Dallas was supposed to be one of a number of hospitals that had actually been through a fairly rigorous training briefing by the Center for Disease Control, and so that everybody was of the, everything, as you said, we got this, was the phrase.
Only a handful of hospitals were supposed to have the necessary materials, the sealed off rooms, and the protocol, which covers everything from treatment to movement, moving the patient around, but they were supposed to be ready.
Yeah, they were supposed to be ready. Lo and behold, what we've been finding as a result, and there have been a number of stories subsequent to the initial break in the case, that indicates that anything that could go wrong about handling a patient with Ebola did go wrong in that Texas hospital.
And we had this discussion before we started taping, and I don't know if it was just people getting casual, the administration at the hospital being a little bit arrogant, just assuming that they had the bases covered. It strikes me as strange, and we were having this out, not having it out, but we were discussing this point. They really weren't ready, were they?
Well, the interesting thing is the stories that are coming out now indicates that that particular patient when he presented himself to the hospital, went to the emergency room, told them he'd just come in from Liberia, had a fever, and these are all symptoms that they were briefed on. If you hear anyone from Liberia or Sierra Leone or Guinea or the three affected West African countries, you immediately flag your Ebola properties. We're finding out that some of the nurses from that hospital are charging that he was allowed to sit in that emergency room with other patients before anyone raised the red flag that he is from Liberia, he needs to be in a separate location. And I'm reading that even when one of the nurses flagged that particular thing, she got some pushback from hospital administration about moving it to some separate isolation area. That was not done immediately. As we know, he was sent home, which is another red flag that they dropped the ball.
And you had already mentioned that he had a fever, but he had a significant fever. It wasn't just a couple degrees above.
Yes, it was in the 100, 203.
103.
Right.
That's what it was.
And you can't get a bigger red flag than 102, 103 fever, Liberia. But he was sent home with antibiotics. They dropped the ball there. I understand that the nurses in the institution and now around the country are clamoring for the fact that the, quote, protective gear that was supposed to have been used as a way of making sure that they were protected from contracting any of that virus was not really the full hazmat type protective gear that one should have had for that kind of affiliation, association, treating of that kind of patient.
I don't know what the ratings are, but it wasn't at that high rating of hazmat use. It was sort of a lower security type bodysuit.
Yeah, well,
not meant for the total seal that you need around the hands, the face, etc.
Yeah, they were complaining that they actually needed tape to actually tape up openings around the neck and places that were being exposed when they put on their, quote, full protective suit. Right. So, you know, you can't have to put tape around a hazmat.
Now, when I think of tape, I think of beekeepers. That's what they do to keep their suits sealed. But they're just sealing it from insects.
Right.
I mean, for a total hermetic seal against liquids and fluid and viruses, airborne or whatever.
Or whatever, yeah.
It needs to be the high level of hazmat suit, which apparently they did not have.
No, and so you have the initial comedy of errors.
And it wasn't reported as such.
Right.
It was reported as they had the proper equipment. But go ahead.
Just sending him home, error number one. And when he comes back, the reports are that even when they're treating him, they don't initially really come into full protective gear. They don't cover their feet, their shoes, right. all the usual protocols that needed to be done. So, in the final analysis, for the stage one big test of how prepared we were as a nation with that frontline hospital, we failed miserably. And so all the, as you call it, sugarcoating that we received from Dr. Frieden and the CDC about, yeah, we've got this, turned out to be a heck of a load of baloney, to put it mildly.
And that's not just us speaking, we're getting that from the nurses now. We're getting good reporting, finally bubbling up from inside of people who saw the procedure and saw not just the inefficiencies, the missing steps and the missing, obviously, equipment that they did not have.
Yeah, here's what's probably even more crazy, and what I say another comedy of errors coming out of the CDC is you now have two nurses who were infected as a result of trying to treat and help this patient. One of them did not have any symptoms initially, and because she didn't show any symptoms or anything, she actually boarded a flight from Dallas and went to one of the Ohio cities. I think it's Cleveland or Canton, I forget which. I think it was Cleveland. But when it was time for her to return to Dallas, she realized she had a temperature that was above normal. I think it was 99 point something. And she called the CDC. And she had, because they have to self-medicate because they've been in contact with the patient, and all these nurses, they've been self-medicating and double-checking their temperatures, see if any symptoms. She did all those protocols. But because she had no symptoms, she flew. But coming back, or returning to Dallas, she realized she was running a temperature. She called the CDC. And what we're finding out now, despite what some of the CDC individuals said in another one of their initial briefings, was, no, she was not supposed to fly, and no, we didn't clear her to fly. Well, the word's out that, yes, they said, oh, your temperature is 99. Oh, that's fine, you can fly. And it's not that she didn't just say, oh, I'm going to fly. She called them for advice.
Right.
All right. I hate to point fingers, but you know what? The CDC is our, quote, big gun, big game authority for these kinds of things.
That's the layer of protection that we have.
Those are our guys.
Right.
Those are our experts.
That's what we're depending on.
Those are our people, okay? And I say our people because we put a lot of money into the CDC, and they're supposed to have the best guys and the best equipment. And the fact that they told her she could fly, and the fact that she got on the plane, now poses all kinds of significant problems because other people have been exposed as a result. Whether or not her symptoms are, what did they say, palpable or obvious, and only when they're obvious is when this disease can be transmitted. But, you know, Bob, there have been some reports. I think we've got one that came up from one of the Midwestern universities, University of Michigan, one of them, I forget which, stating that, you know, there may be some possibilities that Ebola could be an airborne kind of transmission, not just bodily fluid contacts or ingesting whatever. And our good friend, one of our resource people for Media Watch, Pearl Duncan,
right,
actually sent us another email talking about the fact that bodily fluids that are associated with colds, flu, fevers. When you sneeze, guess what?
Yeah.
Sneezing means that stuff is airborne. And guess what? There are some fluids in sneezes, okay? So the fact that there is a very outside possibility or a very good possibility that Ebola could very well be airborne, not just contact bodily fluids and all that, is something that I think people need to be thinking about seriously.
It needs more research, but I guess the other research has spoken against that it needs to be blood or an internal.
No, I understand.
Sort
what
of
the
like
CDC,
sort of like AIDS. It needs to be blood, not spit.
Where I'm coming from is what the CDC has said to us about we've got this, and the protocols that they, quote, put in place that were not in place in Texas, leads me to question whatever the CDC says, or take what they say with a grain of salt, maybe because maybe there's some other researchers who have been studying this stuff that are not in Atlanta who may have some valid data that says, hold on a second, maybe this is something we need to think about or rethink. And
but as you look that up, even the Dallas hospital is apologizing now for the way that the protocols were not handled, and for what wasn't done, and for procedures that were supposed to be taken but were not. He goes on. There's been a number of news reports I was looking at today, and that astonishes me because in a case like that, you need to be ready. There's no, as you can see, no second chances here. Once people are infected, we're talking about a really, really serious disease to eradicate. Apparently, there's the moment has come for the CDC and for a number of these hospitals to step back, reassess everything, and then see if they're actually ready. It's going to take little time, and if they need money, the government needs to be there to help them. I hate to throw money at problems, but if that's what it takes to make sure everyone has the hazmat suits, that's kind of a good way to spend tax money, if you ask me.
No, you need to actually make sure people are properly equipped.
Yes.
Bottom line, whatever it costs. You're talking about preventing potentially pandemic kinds of spread that could be devastating. So if you can spend money, waste money in Iraq for illegal war, you can spend money on all kinds of other crazy nonsense. I would think you could spend money on making sure our healthcare workers are well protected. One of the things, another one of our resource people, Joy Elliott, sent us an email that connected to the fact that the Center for Infectious Disease Research and Policy, which is headquartered at the University of Minnesota, got a commentary submitted to them by some researchers. And what they're saying basically is, and we're quoting, the authors believe, quote, scientific and epidemiologic evidence exists that the Ebola virus has the potential to be transmitted via infectious aerosol particles, both near and at a distance from the infected patients. Now, this is some researcher filing a comment to the Center for Infectious Disease Research. This is not the Center for Infectious Disease Research. This was just sent to them, filed on them. It's now coming out that maybe we need to do some more research and check on this. Don't just blanket say, well, it's not airborne. It may well be. So rather than erring on the side of whatever, let's err on the side of caution when we talk about this disease. One of the things that scares me is the lack of common sense that I'm seeing.
I agree with that. Yes.
We could get into the lack of common sense in media coverage of Ebola, because there's been some serious, but to get back to what we're saying, the common sense that I'm talking about is sending a patient home, and then when he comes back, not isolating him properly, and then not providing the people with the proper suits and whatever. And then as a healthcare professional yourself, even if the CDC is supposed to be the experts and you knew you had been in contact with this person, as a healthcare professional, why would you pick a public commercial airline to transport yourself from one city to another, knowing you've been in contact with something like that? I know you call the CDC, and I know the CDC said, oh, you don't have any symptoms, go ahead and fly. But why don't we think in terms of common sense, saying, well, just in case I might have this, maybe I shouldn't be exposing myself to a bunch of other people on an airplane. That's the kind of lack of basic common sense that scares me, because it's popping up in the healthcare professionals, it's popping up in the administrators of the healthcare system. And so let's say they came out of the gate badly. They get an F for coming out of the gate, as far as I'm concerned. And maybe you folks at home think otherwise. You know, I don't know whether we've ever told you this, but send us an email. You want it on Stadium Circle, or you can send it to erict2456@yahoo.com. Let us know what you think about this Ebola situation.
Yeah, I'll come up with a simpler email for future broadcasts, but that'll be a simple thing. Get a little feedback coming in.
Yep. We don't want to spend the whole show on Ebola just because, but we do need to do some kind of commentary. I love what Jon Stewart did on the Daily Show early last week, but this airs on Monday. But he was talking about how the media was dealing with Ebola, and he was running these montage of clips of all these anchors on all these various cable and news network. It was Ebola. What are we doing about what's about the safety of the country? I mean, it was just hysterical. It was hilarious. So his punchline, which harks back to the old days of the old fireside chat, he said, well, you know, we've just discovered in all this we really have nothing to fear but fear itself. But guess what? We've chosen fear.
Yes.
So
Yes.
I'm not doing injustice, folks, but we need to dial back some of the panic. We need to get better information from these folk at the CDC, and we need to take what they say with a grain of salt and make sure you protect yourself by making sure your own immune system is at its peak, because guess what? That's what's going to help ward off any of these kinds of viruses.
And that was just the point I was trying to make before. We're getting the information, but not the education. I mean, Ebola makes for great tabloid headlines. It makes for great, it gets you into the news broadcast early. There was I don't want to call it a scare, but there was an allegation that someone locally in Queens might have it. And that rumor was blown away pretty quickly, but it made it into the papers just with no problem at all, and it made it across into the news radio. We as the media need to dial back on that. If you're going to report that, put in the disclaimers where necessary. Don't just blurt it out there and then watch people panic.
Well,
that's not the point of our business.
Yeah. Here's my last take on this story for now. The interesting thing is we've got like 3 cases, and there's mass hysteria in our media, crazy nonsense about the country being safe, et cetera, et cetera. You've got Liberia, Sierra Leone, Guinea, folks over there. You've got people like Doctors Without Borders. They're treating thousands of patients over there. They're doing phenomenal stuff. They're not getting, very few of them are getting ill from this disease that they're treating, okay? So they know how to actually do this safely and securely, and we need to take some lessons from them instead of sitting back here saying, oh yeah, we got this, we know how to do this, because we ain't got it, because 2 of our people have already come down with it just for treating 1 patient.
Right.
They're treating thousands. And the other side of that coin is they've got more cases, more severity, they're dying in unnatural numbers, and that story has disappeared off of our media. All we got is Eric Garner, Dallas, Texas, and Ebola in the U.S. So we need some perspective here, folk. There's a whole lot going on that needs to be addressed on why the rest of the world hasn't stepped up to stop this stuff in its tracks in West Africa. Because trust me, if they don't stop it there, then you're going to really have cause for fearing, because you won't be able to contain it just on the African continent, because it'll spread to Europe. Once it spreads to Europe, it'll be here. So that's my take on Ebola. We got maybe 8 minutes left.
We have about 5. Okay. We have about 5 minutes left.
Okay. There's another national story that, of course, percolating, which is the midterm elections. And the midterm elections are just like craziness, because everybody's worrying about who's going to control the Senate. The House is not going to be up for grabs because the states have been gerrymandered so badly, the Republicans will never get voted out of office. And that's actually a fact until new registered voters come in and change their political affiliations.
Right.
The House will be Republicans for the foreseeable future.
We'll need another census and another
That's correct.
drawing. Right. It'll take a while.
It'll take a while. But the Senate is up for grabs, and the question is, will registered voters be able to vote to determine that outcome? There's a big story going on in Georgia right now, Bob. What's the word on that story in Georgia, with the Secretary of State of Georgia losing 40,000 names of people who had registered to vote in the upcoming election, and for some reason they have disappeared. And now it's of course part of a national trend that we've seen over the last 4 years of voter suppression tactics that's been carried on by the GOP. And people have reported on it for years. We've called attention to it ourselves. And it sounds like we're party bashing, but I'd be lying if I said I'm happy to report to you that this is voter suppression by the GOP because it's an actual fact, all right? So people can claim we're partisan, but actually not real. So,
But
the story on, tell us a little, anything on there on that 40,000 missing registered voters?
apparently not yet. I'm just looking at the report from The Root, which is a website that we use once in a while for because they do pretty good research there.
What's The Root saying?
And apparently a number of local organizations went out and got people to register in their communities. And they turned in thousands and thousands.
40,000. I'm
Well,
telling you the number.
Those are the ones that are missing.
That's what's missing.
Yes.
They registered more than 40,000.
Yes,
okay?
they certainly did.
They registered, I think, over 150,000, if not more.
But the Secretary of State cannot account for 40,000 of them.
40,000 of those forms that were filed seem to have disappeared somewhere. So I believe the organization that spearheaded the voter registration drive is probably going to file a lawsuit, has already filed a lawsuit to do something about making sure those votes are found and tabulated, those forms are found and tabulated, so those people have a chance to vote.
So their names obviously appear at the polls, and so that they're not disenfranchised. One day after the midterm election doesn't help anything.
No.
It needs to be done.
Were I in Georgia and I were party to the voter registration drive, my lawsuit that I would be filing would be to cease and desist any election, period, in the state of Georgia. Any election in the state of Georgia, whether it pertained to a federal office, state office, or any office, until those registration forms were found. That would be my lawsuit.
Yes.
I have no idea whether that's what they're doing, but that would be my advice to them.
Okay, we have about a minute left, almost a minute and about 10 seconds. But this obviously will be addressed. There will obviously be a lawsuit, but we've seen this time and time again where paperwork is slowed. I have a good friend who's had her own paperwork slowed down. This record, we need that record, we need the other record. Somehow you miss the election date and it just goes on like that. And some people just flat out give up. So, but I guess we have a lot to talk about in the next week with about 50 seconds left.
Yeah, well, we were hoping to get back to an update on the new staffing lineup at ESPN New York, 98.7 FM. I was on Gardens of Tranquility with Daia Sanusi previous Saturday.
That's WHQR?
WHCR, the City College station. And because she hosted the town hall meeting, she really was not happy to hear about an all-white male lineup on ESPN Radio after so many nice promises were made by Dave Roberts.
But we need to wrap.
But hey, we'll talk to you some more about that. Maybe we'll have Daia come guest with us. But this has been Media Watch. I'm Eric Tait.
I'm Bob Anthony.
And thank you, MNN, EVT Educational Productions, and we'll catch you the next time.